One of the most perpetuating factors in myofascial pain is the emotional component. I would like to introduce to you Dr. Jennie Weisenburger, who specializes in emotional remedies in our practice. Dr. Weisenburger is also an expert in detoxification.
In order to address the perpetuating factors of chronic illness, the structure, function, biochemistry, electromagnetics, and the emotional components, I draw from many different modalities and use them according to my naturopathic principles. One of the modalities that I use to address the emotional component is psychosomatic energetics. I use a system of medicines called REBA Meds and a testing device called the REBA machine to look for emotional conflicts that may be contributing to chronic illness. Using the REBA testing device and applied kinesiology techniques, I test the chakra system of the body and look for which area and which autonomic nervous system center there is an emotional conflict. After identifying the autonomic nervous center or the chakra that's being affected, I'm able to go through different emotional remedies to find what the conflict is. According to my test results, I'll then prescribe complex homeopathic remedies, sometimes along with a more classical single homeopathic remedy, in order to help dissolve the emotional conflict and give more energy back to the system for healing. This system of medicine was designed by an Austrian medical doctor, Dr. Reimer Bannis, and it's being used by many practitioners who recognize and understand the emotions and their contribution to chronic illness. Often people won't need to go through a lot of regressive types of therapy, and using these remedies, I find that my patients are able to work through their conflicts more on their own. Another focus of my practice is environmental medicine. I'm very interested in how toxins in our environment can contribute to chronic illness. Starting from preconception, I'm interested in how the mother's health and mother's exposure prior to conceiving can affect the health of the fetus. And then in childhood, I'm interested in toxin exposure, how that manifests in different types of illnesses, and then also into adulthood. This fits really well with our practice because dental amalgam fillings are a contributor of heavy metal mercury. And I'm also interested in other heavy metals in the environment, our exposure, and also chemicals in the environment and how those contribute to chronic illness. I have many techniques to help mitigate those effects and help the system detoxify so that there's more energy and better cellular health to generate healing.